WFM 91.7.
All right, it's 4 minutes gone past the 10 o'clock mark here on WFM 91 Fantastic 7, Nigeria's first radio station for women and their families. It's about time for that favorite program of mine. Yes, it is time for Radio Doctor. If you are chancing in on the dial for the first time and wondering what Radio Doctor is basically about, yes, it is your free health consultation program where radio doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise on radio on Women Radio 91.7. It is broadcast from 10 a.m. Monday through Friday. Remember, Women's Health on Radio Doctor is supported by ACT Foundation. My name is Chinyere Timothy Crown, and as I'll always advise you to, get a pen and paper, because Radio Doctor is really informative and instructive, especially when we have our Dr. Abosede Leo, the Chief Medical Director, ORB Women's Clinic, doing the program with us. So my doctor is right here and she's ready for the program. Numbers to call to be a part of it: 07000 917 917, 07000 917 917. Feel free to send us an SMS or WhatsApp message to 0703 175 6537, 0703 175 6537. Now, if you've been following the program Radio Doctor for a minute and you have, it has impacted you purposefully, do well to send us an SMS or WhatsApp message with your testimony on 0703 175 6537. If you think there are other ways we can serve you with the program Radio Doctor, also send us an SMS or WhatsApp to 0703 175 6537. I would sincerely appreciate if you get that done. All right. Welcome to the program Radio Doctor. Remember, Women's Health on Radio Doctor is supported by the ACT Foundation. I'll get right into it as our doctor is already standing by. Good morning, Dr. Abosede. How are you doing today?
Hello, good morning. How are you doing today? I am doing fine.
I'm fantastic. Great to have you here always.
Thank you. It's always a pleasure to be on your platform.
All right. Thank you. All right. The phone lines are now open for you to be a part of the conversation. It's 6 minutes gone past the 10 o'clock mark. And this is Radio Doctor here on WFM 917. All right, today we are looking at something very interesting as it concerns women, but not just women. It concerns men also. I mean, because when your wife is ill, I do want to believe that, you're also, vicariously, as they will say in English, you're also ill. So men should also pay attention to the topic for today on the program Radio Doctor. All right, so we're looking at uterine fibroids that we're looking at today, and a lot of myth about fibroid has been in the public domain. Sometimes some people would want to believe that fibroid has some spiritual undertone to it. Maybe it was somebody said, her pastor said, fibroid is occasioned by a woman who has multiple sexual partners. But again, we have Dr. Abosede Leo here this morning to put into perspective what uterine fibroids it's basically about. To join the discussion, you can send your contributions to our social media platforms on Facebook, Instagram, Twitter, and YouTube at WFM 917, or you could log onto our website www.wfm917.com to listen live from any part of the world. Remember, Women's Health on Radio program Radio Doctor is supported by ACT Foundation. All right, Dr. Abosede, what is uterine fibroids?
Thank you so much once again for having me on. And uterine fibroid is something that I'm so happy that we're talking about. Just like you said, the myth. I saw the viral video where something was being made that, like someone was making that assertion that was what was causing fibroid in the young women that have fibroids. And for me as a specialist who have seen a lot of women that have never been sexually active come with really huge fibroids, I mean, a lot of people were triggered by that statement because, again, it just felt like what was really disrupting their quality of life was being given like a bad image or ascribing to what is not the real cause. So fibroid in itself, the first thing I'll say is that it's a benign tumor. And then when I mean benign, it's for us to realize that there are two types of swelling. So tumor is like the swelling. So when I say benign, for women that have it, is to know that fibroid in itself is not a cancer, right? It's an abnormal growth, but it's not a cancer. It is not a malignancy. Now, It is an abnormal growth of fibers of muscle and fibers in the muscles of the uterus. So we say uterine fibroids are benign tumors of the uterine muscle called myometrium. So when you hear people say leiomyomata, it's just saying, what I like to use to explain this is, imagine someone that goes to the gym that has really big arms. It's still part of their normal arms, but they are bigger muscles under the skin there. So fibroid growths are usually like that. So they are benign, they are not cancerous. They are abnormal growth in the muscles of the womb, and it is also quite common. So even if I'm to start with that, that's what it is. It is something found in the womb, in women, in the muscles, and it's abnormal growth there that causes a lot of presentation in some women, and in some women it doesn't have symptoms, but that is what it is. And it is not due to sexual activity or lack of it, in quotes.
All right. Thank you so much, Dr. Abosede, for your thoughts on what are uterine fibroids. I was going to ask if there are various forms of fibroid, or is it just one type of fibroid that we have, which is the uterine fibroid?
Well, so the fibroids that we talk about usually are the uterine fibroids.
Okay.
So, you hear, you remember that I said it's enlargement of the muscles?
Right.
So the uterine fibroid is the common one that we talk about, right?
Okay.
But that's the one that we talk about in the uterus. So it's uterine fibroids. And we say different types based on the location. That's how we categorize it. Maybe when we get to question on, if I say, okay, what are the types of fibroid, if you ask me, I would describe them based on where they are located in the uterus. Are they closer to the outside? Are they closer to the inside of the womb? So let me quickly say that the womb is divided into like 3 parts. So the part that we menstruate from, which we call the endometrium, is there. The part that forms that muscle, that is the myometrium, is there. And then the veneer that covers it is what we call the serosa. So the types of fibroids, when we're categorizing them, is based on the proximity to these 3 parts that I'm talking about. So that's why you hear some women, they say they have subserous fibroid, meaning that they are just under that coat. You hear intramural fibroid, they are right within the muscles. Or you hear things like submucous, meaning they are closer to the place that we are menstruating from. Some you even hear intracavitatory. This is another way of categorizing them based on where they are. So that's how we categorize types of uterine fibroids.
Right. Thank you so much once again, Dr. Abosede, for your thoughts on that. It's now 12 minutes gone past the 10 o'clock mark, and this is WFM 91 Fantastic 7, Nigeria's first and only radio station for women and their families. Yes, we are for women. The program is Radio Doctor. For the benefit of those who are just joining in, you're tuning in now and wondering what program this is, just like the name implies, Radio Doctor is your free health consultation and enlightenment program that was put together by WFM 917 because we're chiefly interested about your health. Now, the program Radio Doctor allows and provides the window for you to speak to a doctor live on radio, present your concerns, whatever medical, underlying health issue that you're dealing with. You have to speak. You have the opportunity to speak with the doctor, and the doctor provides solution. We also have a window that you can physically see the doctor. That can be arranged. If you have been following the program for a minute and you have benefited from it, do well to send us an SMS or WhatsApp message to 0703 175 6537, 0703 175 6537. Call us on 07000 917 917, 07000 917 917, numbers to call. My name is Chinyere Timothy Crown, and I have my guest, Dr. Abosede Leo. She is the Chief Medical Director, ORB Women's Clinic. And what are we talking about today? The central theme for today is uterine fibroid. That's what we're looking at today. And she has given a broad she has expatiated on what uterine fibroids are about, basically, and of course, diminish all of the myth around uterine fibroid having a spiritual undertone by village people, as we say in Nigeria, or being a byproduct of a woman with multiple sexual partners. No, that's not what uterine fibroid is. She talked about it being some sort of growth in the muscles, if I got that right, and it's usually benign. I was going to ask if if there's any point, to what extent can you certify that uterine fibroid is malignant, but I'll leave that for later. All right. So let's look at the second question now. What are the causes of uterine fibroids, and at what age can one develop it?
Okay, so the causes of uterine fibroid, like no one can tell you exactly why one woman will have fibroids and one other woman would not have. However, at least things that are known and established is that it has to do with receptors to, the same hormones that are responsible for the reproductive function of women. When we talk about estrogen, we talk about progesterone. For women that form fibroids, there's something in their receptor that responds to those hormones and lead to growth of those abnormal muscles or enlarged muscles like we talk about. We talk about risk factors, not really causes, because you can see a whole family, only one or two of them will have fibroid, sisters. You can see all of them will have. So if they ask you what are the risk factors to this, in some places you hear family history, they have a family history. We talk about parity, that's the number of children the woman has had or has not had. Mm-hmm. And we talk about early menarche, meaning starting period early. And this is because, like I said, it's the same receptors that are responsible for you attaining this growth and maturity. So a girl that starts in a period very early means she starts getting exposed to those hormones. But then again, you can see a young girl that started a period early and she will never develop fibroids. So there's no direct cause that says, every girl that starts a period early will have fibroid. Some people used to say is weight, but we've seen a lot of very slender women that have huge fibroids. We've seen a lot of women that are on the big side that have no fibroids. And we've seen there's not a direct cause. For some people, it's genetic predisposition. Maybe their moms had. Now, in the old books, we used to see that it's common among women of reproductive age group. So you hear that maybe it comes in the third decade. But at least in practice, a lot of us know that a lot of girls and their ladies in their 20s, in fact, I've seen teenagers that have fibroids, 18, 19-year-olds. I've once seen a lady at 22, she was going for a second myomectomy surgery. So again, it can start earlier than even expected. And another risk factor we talk about is that being someone of African descent, we tend to have it earlier. And this is also an opportunity to say it is very common. In fact, we don't know the true incidence, but people will tell you that as much as 7 to 8 in 10 women have them. Now, we should also bear in mind that in a lot of women, it is not symptomatic. It has no manifestation. So for some women, it's just an incidental finding. They went to go and look for something else, and then I said, by the way, we saw this on the scan. For a lot of women, it doesn't cause symptoms. The ones that we now kind of come and treat are the ones that present with symptoms, and then of course based on the size, the location, desire for fertility and all those kind of things. But a lot of women live their wholesome lives. They never know. Maybe they just even went for a routine checkup and then they say, madam, there's a little fibroid there, but there's nothing else apart from the fact that the fibroid is not disturbing their quality of life.
Right.
So no one can really ascribe. However, some of the associations that have been sort of emphasized is that there is a bit of a connection between smoking and caffeine and taking a lot of alcohol as well, that this may be something that propagates the growth of fibroids. Like I said, this is an association. It's not like a direct cause, because again, you see a lot of people that drink, a lot of people that take caffeine, and they still don't have these fibroids. So nobody can tell you exactly that this is the cause. And then let me quickly chime in here. When I was talking about the different types of fibroid, we also have one more that is something we call pedunculated. It's like something that is attached. It dangles on the stalk. I forgot to mention that when I was mentioning the types.
All right. Thank you so much, Dr. Abosede, for your thought on that. 18 minutes gone past the 10 o'clock hour here on WFM 91 Fantastic 7. The program is Radio Doctor, yours truly, and I am Chinyere Timothy Crown. What we're looking at is uterine fibroid, the causes, the myth, and the possible solutions to uterine fibroid. I mean, this is something that affects, most women across board. I have friends who have gone under the knives multiple times for uterine fibroid. So your questions should keep coming in, or should be coming in right now on 07000 917 917, 07000 917 917. If you are concerned about, what the issues you have is a bit segued from the topic we are discussing, feel free to also call in and ask Dr. Abosede your question on 07000 3000 917 917. Send us an SMS or WhatsApp message to 07031 756537. Dr. Abosede, while you were talking inter alia, you mentioned that sometimes fibroid is asymptomatic. So I was tempted to ask you if it's possible for a woman to live out her entire life without getting to find out or getting to have her stomach, protrude, and she just live from when they're born, even with the fibroid till she die. I wanted to ask you that, but I won't ask you that. I'll rather ask you I understand it's not all the time that it's asymptomatic, right?
Mm-hmm.
So when the symptoms present, what are the symptoms that one should look out for to certify that, okay, so this is uterine fibroid?
Okay. So when a woman has symptoms, it is a suspicion until it is confirmed on diagnosis. So even if all the symptoms are pointing out, the woman should still see a specialist so that we can say, okay, this is what we are dealing with. So what are the symptoms that the woman can present with? Remember that I talked about the different types of fibroid, meaning where they are located. The symptoms a woman that has fibroid presents with depends on location of the fibroids, the size of the fibroids. So those that have those ones that are closer to where we menstruate from, like I talked about, they expand the surface of the endometrium, which is where women menstruate from, and also makes the place have more blood vessels. So those are the women you hear them present with heavy menstrual bleeding. I have met women that they don't even use pad for their cycle anymore. They use Pampers, adult Pampers. Some use small towels because sanitary towel cannot do anything for them. So the very common symptom you see is that some women have heavy menstrual flow, heavy in volume and prolonged. So instead of even having the maximum of 7 days, some can even tell you they've been bleeding for like 2 weeks because the surface area that they menstruate from has been enlarged and is congested. Now, another symptom they can present with is, especially those that have those big ones within the muscle, is dysmenorrhea. That's menstrual pain. You get severe menstrual pain. Imagine something that is like smallish inside, but because of the enlargement by all those muscles, the level at which they contract during their own period is very intense. So a lot of them present with menstrual pain. So we can see women that have heavy menstrual flow, people that have dysmenorrhea. Like I said, the symptoms depend on size and location. For some women, the way the anatomy of the body is, the uterus is closely associated with the anus and rectum posteriorly and anteriorly associated with the bladder. So for some women, when it has become large enough to start pressing on their bladder, some of them start having urinary tract infection. They'll be going to the urine to urinate all the time. Sometimes they finish urinating, they feel like there's still something remaining in their bladder. Sometimes they even have urinary tract infections. For some people, the fibroid has compressed so badly on their uterus, on their bladders, that urine starts to go back through the tubes into their kidneys. So it can actually damage kidneys if you leave it and it's really huge. For those at the back, we talk about constipation, difficulty in going to the toilet because the fibroid is pressing on their rectum and their anus. So it makes it very hard, if not impossible, to go to the restroom without help for a lot of them. Now, for those that don't have all these issues, some people, what they present with, it could be subfertility. Maybe they've been trying to get pregnant and they can't. And then by the time you evaluate them, do scans and do tests, you find out that the location of the fibroid, some is preventing sperm from passing, preventing their eggs from being picked up, preventing babies from being formed, because we have women that have fibroids that are sitting right, that's the one we call intracavitatory, sitting right inside where they're supposed to keep babies. Those ones, it makes it difficult for them to get pregnant.
Okay.
So we have those that present like that. We also have those that present with, they get pregnant but they miscarry. Also because the fibroid sometimes is pressing where the baby is supposed to stay or is competing with space from where the baby is supposed to stay. And some of them suffer early pregnancy losses, unfortunately. But those are able to carry the pregnancy, you hear something that they have this recurrent admission from like 4 months of pregnancy because it's the baby and the fibroid competing for blood. So she's severe pain, we have to admit them. Some of them have to deliver very early. Some of them have where placenta separates prematurely from the womb before the baby is ready, bleeding, and even in labor. Location of fibroids can determine the mode of delivery. If the fibroid is in such a place that they cannot push vaginally, we have to resort to surgical delivery. Sometimes where this fibroid is on the uterus determines the complexity of the CS. It's not just regular CS. So all these things come into play. Even after they deliver, it takes a long time for their wombs to come back to normal. They're at risk of infection. A lot of them bleed after delivery, regardless of the mode of delivery, just because those muscles are restless. They keep contracting, and it's sometimes difficult to repair, very difficult to secure in most cases. So women can present, you can see all these different ways that, in fact, we know those that present with dyspareunia, that's painful sexual intercourse. Women that have pedunculated fibroids, that the fibroid that is even occupying their vagina, some of them cannot even have intercourse with their sexual partners because of pain and discomfort. So it's a wide range of symptoms that can present in women that are symptomatic with uterine fibroids. And of course, for those that have been bleeding for a long time, they present with features of anemia. And if you don't take care of the anemia, some of them end up developing even other medical conditions, cardiac problems, just because they've been on prolonged anemia that has challenged their heart. Those who have transfused them with blood, they could not access blood and all those kind of things.
Right. Thank you so much. I mean, listening to you talk about this, I must say it's quite labyrinth. The body of a woman or a human being. I mean, God is so awesome to have put all of this together. Thank you so much, Dr. Abosede, for explaining that in detail for us. I have just learned that the reason why some women still get pregnant, even with fibroid even when they have fibroid, is because of where the fibroid is located. So when the fibroid is located where the baby is supposed to sit, that's when it's almost impossible for a woman to get pregnant. Because of that. I mean, this is really instructive, I would say. 25 minutes gone past the 10 o'clock hour, and this is Radio Doctor here on WFM 91 Fantastic 7. Remember that Women's Health on Radio Doctor is proudly supported by the ACT Foundation, and today we are looking at uterine fibroid. You should be a part of it. 07000 917 917, 07000 917 917, 0703 1756537. Numbers to send your SMS or WhatsApp message to 0703 1756537. We have Dr. Abosede Lewu here this morning looking at uterine fibroid and, the myth, the realities, and how it should be prevented and possibly be treated. All right, I'll head straight to our messages this morning and take some messages before we go on. This one is from Agnes. Agnes is messaging from Badger, and it reads, "Good morning, doctor. I am always having cramp when having my period. Does it contribute to infertility? I am 25 years of age." Thank you so much, Agnes, for sending this in.
Okay, so one of the things I always tell women is that you cannot diagnose yourself of infertility when you have not actively tried to conceive and you have failed to. So because even the definition of infertility itself requires that you've had regular sexual intercourse, unprotected, penetrative, regular, ejaculatory, for someone that's 25-year-old, if there are no underlying medical conditions, for a year before you can be diagnosed of infertility. And so for a single person, you shouldn't be worried about infertility per se. However, that is not to say that a single person should start living a risky life. It's just to say having menstrual pain is dysmenorrhea. That is a separate diagnosis on its own. And if we were to diagnose everybody that had dysmenorrhea with fibroid, that would be unfair. Women have different dysmenorrhea for different things, like for different reasons. Congestion, all sorts can lead to dysmenorrhea. So you have to so there's no way to say I'm tying this dysmenorrhea to infertility. It doesn't work like that. Even women that we have known over the years that have had irregular cycles, worried about conception, get married, and within a month or two, they conceive. And then you see those that have had no gynae problems, no gynae complaints, also having delay in conception. So these things are not hard and fast rule.
Right.
So the fact that you're having dysmenorrhea may be totally unrelated to fibroid. And if it's related to fibroid, it's from evaluation that we're going to know that.
All right. Thank you so much, Dr. Abosede, for your response to the message Agnes from Beja sent in. Agnes, I'm sure you're listening to radio and you heard the doctor's submission to the message you sent in. If you need more clarity on that, do well to message us on 0703 1756537, 0703 070-175-6537. Agnes, I'm sending this message to you now. Send us an SMS if you need some more clarity on 0703-175-6537. Call us on 07000 917 917, 07000 917 917. To join the discussion, you can also send in your contributions to our social media platforms, Facebook, Instagram, Twitter, and YouTube at WFM917.com to listen at WFM917. You could log onto our website at www.wfm917.com to listen live from any part of the world. Remember that Women's Health on Radio Doctor is supported by the ACT Foundation. I'm Chinyere Timothy Crown, and our radio doctor today is Dr. Abosede Leu. She is the Chief Medical Director, ORB Women's Health. Dr. Abosede, I'm going to share a story with you and ask you why that is. So I have a friend. Before then, I'll take this call. Hello, good morning. Hello, good morning.
Yes, I'm Yusuf Olamide.
Yusuf, good morning.
Good morning. I'm enjoying the doctor analysis. I just want to ask, is the constitution of women's stomach, as in when women have a big stomach, is it a symptom of that fibroid as well? Is it a symptom that one should always take note of? Thank you.
So much for your question.
So for some women, abdominal swelling is actually how they know that they have fibroids. So for those that have the enlarging type, because like I told you, some can have small ones that you cannot see, but because it's close to the lining of the womb, they bleed a lot. But for some women, is that if you have that one closer to the outer coat that I talked about, and it gets really big, you can actually see it from outside. I've had people tell me that, it was their parents that I was asking them that, why is your tummy looking big? They're not even having any symptom, but their tummy is getting bigger. But of course, that is when we now evaluate, we can say, okay, maybe this is just fat. Maybe this is just you adding weight, not necessarily fibroid. But yes, some women, the symptoms that they present with is actually as the fibroid becomes very big and comes out of the pelvis into the abdomen, it begins to protrude. Some women with their fibroids, because when we even measure fibroids, we measure it the way we measure pregnancy. So you hear us writing 20 weeks. I've seen women with fibroids that are 38 weeks, like as if it's 9 months pregnancy. Okay. So for some women, that's how they present. Yes.
Right. Thank you so much, Abosede. Let's take this call now. Hi. Good morning.
Morning.
Hello.
Hello.
All right, call us back on 07000 917 917, 07000 917 917. 29 minutes to the top of the hour, 11 a.m. This is WFM 91 Fantastic 7. The program is Radio Doctor. Dr. Abosede, my friend is 50, right? And she's removed fibroid over say maybe twice or thrice, and then the doctor advised that she should take off her womb. I don't know why this is, but I'm just telling you a real life story. So she took off her womb, right? The last one was really terrible that the doctor had to advise her. Maybe her womb was perforated. I don't know what the challenge is. So this leads me to my next question. When one undergoes, treatment for fibroid, why does it keep repeating? I mean, my immediate elder sister, did a surgery for fibroid, and as we speak, I think she's still complaining of her leg, they pain her, and she's heavy bleeding, and maybe she went for a scan, and they are saying that maybe it's budding again. How can one prevent uterine fibroids?
So uterine fibroids basically is not preventable because you don't even know if you're going to be a fibroid former or not. Now, as to why fibroids go back, one of the things we need to first internalize is that fibroid is a part of the woman's body that is simply growing in a way that is not supposed to. So what happens is that when a woman has fibroid and we take it off, remember that so the options of management of fibroid include expectant management, where you don't do anything, especially for women that don't have any symptoms. Sometimes maybe if the woman is getting close to menopause and the symptoms are not so much, there can be things we can do and wait for her to just enter the menopause, and then we know that's the end of it. Now we have the medical, and then we have the surgical intervention. So in the surgical intervention, we have the conservative one, which is the fibroid removal that we usually do, right? And then there's the one that is the non-conservative, which is the hysterectomy, where we take out the whole womb from day one. Because remember that if we do hysterectomy, there's nothing that can grow back. But whenever you do a myomectomy, you have simply taken out the abnormal growth. That's the fibroid tissue. But remember that those abnormal growths came out of the normal growth that the woman had before the fibroid started growing. So whenever you remove fibroid from a woman, the normal muscles that are still there, because the woman is already predisposed to forming fibroids, those ones that were normal at the time of the surgery, so long as the woman is still ovulating, menstruating, still being exposed to those primary hormones that cause the first fibroid, they can still re-stimulate her to grow another fibroid. That's another counseling we emphasize, that taking it out, yes, it's very good. But if you're a fibroid former, if you're someone that forms and your fibroids grow very fast, they can regrow again. So that is also a risk that comes with the conservative operative method. So like the woman you talked about that has had 2 or 3 surgeries,
Yes.
she takes them out, but they spare her womb. So the womb that was at the operation, nothing was growing there. The same stimulus is exposed to it again, and then the woman grows the fibroid again. And that is not to say that's enough reason to say I don't want to take out my fibroids. I've also seen women that said all my friends that took it out, it came back, and then by the time they have to remove it is maybe when the fibroid is so big it has destroyed the kidneys, it has destroyed. It's like a catch-22. When fibroid needs to be removed, you have to remove it, but there's also the risk of it growing again. Now, one of the things we talk about is for some women that are maybe they're in committed relationship, they're trying to get pregnant, the time where they get pregnant and breastfeed also gives them like a break away from the hormones that are bombarding them that stimulates the growth. So I've seen a lot of women with fibroids, after the surgery, they go ahead to have children on and off for about 6, 7, 8 years. They'll tell you maybe the symptoms were a bit better. And some, after they have those children, they just tell you that, doc, I'm no longer doing conservative management. Just take away this one because it's already growing back. So that can happen. Now, for the woman that they asked to do a hysterectomy, of course, I don't have the full history. There must have been something that prompted that decision from the surgeon that made that call on that patient's care. But yes, it does happen. It does regrow because the whole system has not changed. We just took out the manifestation, but whatever is stimulating there is still presently in the woman's body. So it's like I said, it's a catch-22 situation.
Right.
When you have to remove it, you have to remove it, but it can grow back.
All right. Let's take this call, doctor. Hello, good morning. Hello? Hello? All right, do well to call us back on 07000 917 917, 07000 917 917 to be a part of the program Radio Doctor. Remember, Women's Health on Radio Doctor is proudly supported by the ACT Foundation. Welcome to the program Radio Doctor. If you're just joining in for the first time, this is Nigeria's first radio free health consultation program where doctors are brought live on radio to attend to your health issues. All right, let's take this call. Hello.
Hello, good morning.
Good morning. What's your name and where are you calling from?
I'm Tajuddin, calling from Joko in Ogun State area.
Tajuddin, good morning. Let's have your perspective.
Thank you very much. All thanks for all contributors to this program. We're grateful. But I'm sorry, my question differs from this fibroid thing. You want to ask from the doctor what might cause them having the dysphagia feelings on the feet, like no, there's no fluid there, and a very severe cold on the feet, especially at times like that, very severe cold. So, thank you so much.
Tajuddin, please stay on the line. Dr. Abosede, did you get his question?
He said he's feeling like a lot of sensation on his feet and he feels very cold.
I said on the feet. I said I'm having this every feeling on the feet. Like there's no transportation of fluid there. And serious cold on the feet. Serious cold.
Okay. So, full disclosure, like you know, I'm a gynecologist, but I will advise that you see a physician. It sounds a bit like he's having some sort of neuropathy or maybe circulatory issues, so he will benefit from seeing a physician. Once they see at let's say a government hospital, they will triage him take a full detailed history and triage him, because this symptom you're complaining about, we see them in people that have diabetes, we see them in people that have some sort of cardiac issue. They have to check you to know whether you're having some sort of neuropathy or some sort of disease condition that is affecting circulation to your leg. So this is not something that you diagnosed on the phone. You have to see a physician for this.
Thank you very much.
Thank you so much, Tajuddin, for calling. Have a great day.
Yeah. Thank you, madam. Thank you.
All right. Bye-bye. All right. We should hear from you. 07000 917 917. 07000 917 917 numbers to call. Send us an SMS or WhatsApp message to 0703 1756537. I'll go straight to our phone line portal. I see that it's beeping. All right, so call back 07000 917 917. Remember that the program is proudly supported by the ACT Foundation. All right, so I'll just take some more messages this morning. This one says, good morning. My name is Ayo from Sango. I'm 22 years old. I ease myself a lot in the day within intervals, especially at night, and even after passing urine, I still feel like more is coming, and I had to spend few seconds, and after that comes small urine. Thank you so much, Aya, for sending this in.
So again, the process of diagnosing the patient includes taking a detailed history. So I've listened to what our esteemed messenger said to us, which is about our frequency and something we call nocturia. So there'll be follow-up questions. When did this start? Do you have painful urination? Do you have lower abdominal pain? Have you noticed the color of your urine? Have you noticed any flank pain? Like, this is me asking to rule out any renal or even pelvic inflammatory disease. After that, I'm going to ask you abdominal symptoms. Any change in your cycle? If you're sexually active, any painful sexual activities. So all of this together is what will help me to sort of diagnose you of what is wrong. But even the symptom you have presented with is enough to go to the hospital to know whether you're having a urinary tract infection, are you having a pelvic inflammatory disease, or could it be a signal that, you're 22, but still you want to be evaluated to be sure that there's nothing putting pressure on your bladder as well.
Right.
So I think you can go into into a clinic and be evaluated immediately.
Right.
Immediately, like today, if possible, tomorrow.
All right. Thank you so much, doctor. Let's take this call. Hello. Hello. Good morning. What's your name and where are you calling from?
This is Joyce. You can call us from Oba, Lagos.
All right, Joy. Thank you so much for calling in. Let's have you.
Okay, my question is, Doctor, I'm 39 years old, and I've had 3 children. So after my last baby, I did the family planning, which I have been doing for over 4 years now. I've been trying to take in the thing is not working out, but I noticed that I'm having heavy flow, which is not normal or what I used to have before. I've gone for several scans, they said everything is okay. But up to today, nothing has happened. The period is still heavy like that, and it comes with clots when it's coming, clots. So I don't know if there's any solution we can get towards that, sir. Thank you.
All right, Joy, please stay on the line so the doctor can ask you a few questions. Dr. Abosadi.
So I didn't hear at the beginning. I think she said she had a baby. I can't hear. I don't know the first part of the question. If you could take the question.
Okay, I have 3 kids.
Chiyo, did you hear?
Yeah, she has 3 children.
Yes.
Mm-hmm. Go ahead.
So the last 27 days, after the last baby I had, that was 2016, I did the family planning. So, after 10 years, I removed the family planning. I was trying to take in for the first one. It's not coming, so I did some scans because I noticed that my period was busier than it used to be. So I've gone for several scans. They said everything is okay. Up to today, nothing has happened, and the period is still the same way it has been coming, very heavy. So I don't know if there's anything again I can do towards it.
Okay. So your last baby was in 2015. You used the perceptive method. You took it out, and then you've been trying to get pregnant, and you've not been able to achieve pregnancy, and your period is still. So did you see me? How old are you now?
39.
Did she say 31?
She's 39.
39. Okay. Okay. So again, one of the things we talk about when you're trying to achieve pregnancy is that both you and your partner must be evaluated. It's yourself. So your husband also has to do at least the baseline test, which is to assess the sperm quality. Sperm count. There is no. That's one. Secondly, beyond sperm, there are other things that you need to evaluate a woman that is having heavy menstrual flow. So let's say you come to see a specialist like myself. Apart from taking a detailed history, there are other investigations that we're going to request for to actually get to the root cause of why you're bleeding heavily. You say you even pass clots, if I heard that part very well. So we should know that it's done. So let's say we're able to get to the root cause of why so let's say your husband, everything is okay with the sperm. We found out what is wrong with that's making you have heavier than normal flow, and we're able to correct it. Spontaneous pregnancy can actually still happen. You're 39. However, it's to also know that as a woman, one of the things that tell us women is one of the important factors that affects our ability to conceive very fast spontaneously is age. So again, as you're 39, our ovarian reserve starts to drop. The rate at which we conceive spontaneously, especially for someone like you that has had 3 children, maybe you're just getting pregnant fast. Who you were when you were in your 20s and early 30s is different from who you are now that you're 39. So what I would advise is you need a full gynae evaluation for yourself. Your husband's sperm quality must be assessed, and then we should just kind of get into action to evaluate you holistically to find out what is causing that menstrual irregularity. And even that people of clot in the stomach is not healthy for you, because it's likely you may be losing blood than is expected for you to lose at period. So you want to make sure that that is also not causing a bit of hemodynamic like stress for your body as well. So again, like I said, it's a full, even from physical examination, from me seeing, when I finish all that, we kind of design what test does this woman need to go to. Because by then I will have had my mind on 2 or 3 things I'm trying to say, this is what is wrong, this is what is not wrong, and we're going to address it that way.
Okay.
All right, thank you so much. Joy, are you clear enough on what the doctor said?
Yes, ma'am.
All right, thank you so much. I sincerely appreciate you for calling in. All right, keep the calls coming in. 07000 917 917, 07000 917 917. Numbers to call 0703 175 6537. Numbers to send your SMS to. It's now 40 minutes to the top of the hour, 11 a.m. And this is WFM 91 Fantastic 7. The program is Radio Doctor, where doctors converge here on radio to attend to your health, and consult for free, which is a very important part of the program. Remember that Women's Health on Radio Doctor is supported by the ACT Foundation. What are we talking about today? We're looking at uterine fibroids, the myth, the realities, and how it can be treated. So, Dr. Abosede, you have, in your response to some of the questions, you have encapsulated and expatiated on some other questions that I wanted to ask you, like, say, risk factors, if fibroid can hamper a woman getting, a woman's fertility. You've talked on and touched on that. I just want to ask you if a fibroid, can go away without being operated on. Have you, in your meteoric trajectory as a doctor, have you had cases where somebody was diagnosed with fibroid and she didn't, go under the knife? We have a caller now. Sorry. Hello.
Hello, doctor.
Good morning. What's your name and where are you calling from?
It's Mr. Jack.
Mr. Jack, where are you calling from?
I'm calling from Kute area.
Kute area. All right, go ahead. The doctor can hear you.
So I want to ask that medication I used to prevent pregnancy and start pregnant 3 months something. Can I prevent that fibroid? Can I cause it?
Mr. Jack, please stay on the line. Dr. Abosede, did you get his question?
No, enough.
Okay, for preventing pregnancy, women who take injections once in. Okay, so we lost Jack now. Women who, in trying to regulate pregnancies, they take, injections, some for 3 months, every 3 months. He's asking if this can, predispose a woman to having fibroid.
No. So in fact, one of the studies that have been carried out is that some of those injections actually even reduce a woman's chances of having fibroids. So injectable contraceptives are not associated with development of uterine fibroids. So
Right.
they're not.
Okay, great. Jack, I'm sure you heard the doctor. She said no. As a matter of fact, some of those injections actually reduce the risk of having fibroids. So I was asking you, doctor, if there's a possibility, if there's that sort of miracle that happens, that someone was, diagnosed with fibroid and she comes again for evaluation and voila, it's not there.
So remember that we talked about most women that even have fibroids will probably never know or ever experience symptoms. Now, one of the things that also happens, what I have seen a lot of times is women that have had fibroids that have disappeared after childbirth. So one of the things that happens is if you have a fibroid that is not significantly big, that is not even disturbing you in any way, the process of getting pregnant, the size of a womb is like size of a pear. You know that small pear that we eat. But by the time a woman gets pregnant and carries a pregnancy to 9 months, the womb is as big as a very huge watermelon, like very, very huge watermelon. So we've seen that in some women, after a woman has children or has delivered a child, what happens is that watermelon has to shrink back to the size of a pear. And so that one is a natural process where all those cells that expand, they die off and become smaller and go back to that pear shape. I'm sure you've seen a lot of pregnant women after the baby, their tummy is still big. Then, like maybe a few months later, you see that you can't even know that they just had a baby.
Right.
Even if you see it's only the abdominal fat you're seeing. For some women, in the process of that happening and the uterus remodeling itself, it actually takes out the fibroid tissues and the fibroid cells in those women. And then maybe they had fibroids even before pregnancy or they found during pregnancy. Then they come back for the next scan. They're like, wow, there's no fibroid again. For some, they come for the next pregnancy. The fibroid that they saw in their first or second pregnancy is no longer there. So for some certain women, the remodeling that happens postpartum is associated with disappearance of existing fibroids. Like I said in itself, the presence of fibroid is not the problem. It's when there is symptomatic fibroids, right? So a lot of women, so like you said, this one, I have seen people that had fibroid at this point, and then they check later, they don't have fibroids anymore. Okay. So that can happen. But like I said, even it being there, so long as it's not disturbing the woman, it's just an abnormal growth that is just there.
All right. I'll take this call now, doctor. Hello? All right.
And then sorry again, another time fibroid can disappear is after menopause because the hormone that is feeding it is no longer predominant. It's estrogen, progesterone.
All right. Thank you so much. We'll take this call now. Hello. Good morning. Oh, Jack.
I want to ask a very serious question. Of course. So if you know something like grain of rice, something smaller than grain of rice, what do you need?
Please stay on the line, Jack. Dr. Bossede, did you get the question?
No, I didn't know.
Jack, can you repeat the question? Okay. Okay, so I'm just going to repeat the question to the doctor in the event that she didn't quite get you. So he's asking, did you get the question, doctor? That's fine, Jack. I'm going to relay the question to the doctor, but stay on the line because she might want to ask you a few questions. So he's asking that on the blockhouse, there's something like a grain of rice, a small grain of rice there. So he's worried what that could be. If I actually understand what he was talking about. He said the blockhouse, there's something like a grain of sand, a grain of rice there. So he's concerned if this is something he should be worried about.
If it was something that wasn't there before, it's definitely something he should go and evaluate. So the specialist that should see him for that is a urologist. So those are the ones that take care of, they are the equivalent of gyno for male as well. Okay. So you should look for a urologist to assess his genital area and to also monitor that growth, to evaluate, to see if it's something to worry about now or something to take care of. All right. So yes, it's something you should take to the hospital place to see a urologist.
All right. Thank you so much, Dr. Bossede. Doctor, can we have your final thought on uterine fibroid. For those who have gone under the knife or those who are looking to prevent uterine fibroid, what sort of lifestyle would you advise them to begin to lead?
So I'll start with for those that have had symptomatic fibroids, because I know that when we say fibroids are benign, we only mean they are for those that have symptoms now. When we say fibroids are benign, we mean they are not cancers. But that does not also reduce, that should not take away with the power and the impact it has on their quality of life. As a gynecologist, you've lived with a lot of women through this process, how these fibroids have distorted their life, their work-life balance, their relationships, their ability to have the family of their own when they want it. It's just something that disrupts, for those that have really symptomatic ones, it's something that disrupts their quality of life. For those that have had surgery and now have to go for surgery, there's an extra layer of stress to that, because again, you've been through this before, you've done what is expected, and then it's back. What I would just want to send them to them is a big hug, love and light, and to know that you are doing the best that is possible and that is best for you in this phase you're in. And to know that there's nothing wrong in you being reluctant initially. There's nothing wrong in you being angry and saying, why me? Why am I going through all this? But one of the things I want you to take away is that don't be afraid of a second opinion. Don't be afraid to try out a new specialist. Don't be afraid to just okay, I'm going to hear what other people have to say. And then when the decision has been made that surgery is what you need, just be strong and go for the best. Ask about this doctor. Ask about the hospitals. Ask questions. Do a lot of research so that your questions can be answered. For those that are, so you've not had surgery, you're thinking of preventing it. Really, you can't prevent fibroid directly, but we all know that if you have a good lifestyle, it always makes your life better. Okay. So we talk about reducing alcohol consumption, reduce caffeine consumption, stay away from smoking, just about living healthy lifestyle, and then also embracing the habit of medical checkup.
All right.
Like I said, some of these things, a lot of women, they find it incidentally. And we have a lot of fibroid patients in our clinic where they just do scans once in 6 months or 12 months.
Okay.
Some people in 7 years, their fibroid went from maybe like one small rice to one big. So at least those ones are confidently leading life that say, okay, this thing is there, but it's not disturbing me.
All right, okay.
Ignorance is not bliss for fibroids.
All right.
If you think you're having fibroids, if it's disturbing you, it's something that you need to take care of.
Absolutely.
And for older women is to also understand that there is room for not even older women alone. There's something we call expectant management. There is medical management. There are even surgical management now. There are minimally invasive procedures now available in Nigeria where we talk about people using minimally invasive laparoscopic procedures, stereoscopic procedures. So it's now here. So that is why I say you should not be afraid of a second opinion. There are fibroid cases that will be treated through medical interventions, through minimally invasive procedures, through major surgery. So ask questions and seek out several opinions before you make your decision.
All right. Thank you so much, Dr. Abosede, for today's free consultation and advice on uterine fibroids. Dr. Abosede Leo is the Chief Medical Director, ORB Women's Clinic. We sincerely appreciate your time always on the program. Thank you so much. Have a great day. Women's Health on Radio Doctor is supported by the ACT Foundation. Thank you so much to the producer of the program, Esther Alaribe, and the executive producer, Ton Okewale Shonaya. My name is Chinyere Timothy Crown. Thank you for all those who are listening and calling and sending you SMS. We sincerely appreciate you. Have a great day and keep listening to WFM 91 Fantastic 7. Bye-bye.
WFM 91.7.